Hello, I'm Dr. Abhay Chopada, and I am experienced in both gastroenterology and surgical practice. When it comes to hernia repair surgery, one of the most debated topics among surgeons and patients alike is the use of surgical mesh. Hernias affect millions worldwide, and choosing the right surgical approach is crucial. Today, we'll explore the pros and cons of mesh and no mesh techniques in hernia surgery, helping you understand your treatment options better. Before diving into the mesh debate, let's understand what a hernia is and why surgical repair becomes necessary. A hernia occurs when an organ or fatty tissue squeezes through a weak spot in surrounding muscle or connective tissue. Common types include inguinal, umbilical, and incisional hernias. The goal of hernia repair surgery is to push protruding tissue back into place and strengthen the weakened area to prevent recurrence. Surgical mesh, introduced in the 1980s, offers several significant advantages. Research shows lower hernia recurrence rates compared to non-mesh techniques. The mesh provides additional support, effectively reducing tension on surrounding tissues. Many patients experience quicker recovery times with mesh repairs. Its versatility allows use in various hernia types and sizes, making it a valuable tool in modern hernia surgery. While mesh offers many benefits, it's important to understand potential drawbacks. Some patients may experience complications such as infection, adhesion, or erosion. There's a small risk of chronic pain following mesh repair. As mesh is a foreign material, some patients might have adverse reactions. If revision surgery becomes necessary, the presence of mesh can make the procedure more challenging. These factors must be carefully considered for each individual case. The development of surgical mesh represents a significant advance in hernia repair. Just as we've seen improvements in other medical technologies, hernia treatment has evolved considerably. The experience of millions of patients worldwide has helped refine our understanding of both mesh and non-mesh approaches. Success rates vary between techniques, but both have proven effective in appropriate cases. Each patient's situation requires careful evaluation to determine the best approach. The field of hernia repair continues to advance with new developments in mesh materials and surgical techniques. Bioabsorbable mesh represents an exciting innovation designed to be absorbed by the body over time. Robotic-assisted surgery offers enhanced precision for both mesh and non-mesh repairs. These ongoing developments demonstrate how surgical science constantly evolves to improve patient care. Think of hernia repair options as choosing between different types of support systems, each with its own unique strengths. Some patients prefer the extra reinforcement of mesh, while others opt for the traditional approach. It's like choosing between different construction materials for building repairs. Each has its place in the right situation. The best part is that modern surgery offers multiple paths to the same destination, a successful hernia repair. Choosing between mesh and no mesh repair depends on several factors: hernia size and location, patient age and health, previous surgeries, and surgeon's expertise. The skill and experience of your surgeon significantly impact outcomes. Recent developments in surgical techniques continue to expand available options. Working closely with your surgical team ensures the most appropriate choice for your specific case. Your hernia treatment journey is as unique as you are. By staying informed and engaged with these various resources, you're not just learning about surgical options, you're preparing to make the best choice for your health. So keep reading, keep connecting, and keep exploring your treatment options. Until next time, this is Dr. Abhay Chopada, reminding you that when it comes to hernia repair, knowledge truly is power. Happy learning, and here's to the successful outcomes.